presentation discussing some of the standards updates for exercise professionals, particularly for individuals who will be sitting for ACSM certification exams this coming year. And as we transition from the 10th edition of the Guidelines for Exercise and Testing and Prescription to the 11th edition, we just wanted to make you aware of some of the changes that you should be thinking about as you study for these exams. I am Christy Ward-Rotacco. I am the chair of the Committee on Certification and Registry Boards, or the Certification Board as we like to call it, for the American College of Sports Medicine. And I am joined by two former chairs of the CCRB and two professionals who have helped to collaborate and bring to you some of these changes between the two editions. So joining me today is Dr. Deb Reedy, as well as Dr. Madeline Pasternostro Bayless. And if I murdered your name, Madeline, you're going to help me. All right. Thanks. So we're happy to have you with us today, and we're excited to bring you some of this information to make sure that you feel confident when sitting for ACSM certification exams. So we're hoping that today's session provides you with a brief overview of the important changes to the professional standards and guidelines that are presented in the American College of Sports Medicine Guidelines for Exercise Testing and Prescription, particularly in the 11th edition. While this is not a comprehensive review of all professional standards, what this should do is highlight some of the changes that have happened between the 10th edition and the 11th edition. And we really, one of the other goals of our presentation today is really to encourage you to become familiar with some of these changes that have emerged in the 11th edition of the guidelines. We're very proud of these guidelines. We've had them for a long time. We respect them very much as exercise professionals, and we do utilize these guidelines to create safe and effective exercise prescriptions, and they reflect safe and effective professional exercise practices.
So I'm going to go over two of the changes that occurred between the 10th edition and the 11th edition of guidelines. One of the things that changed, and you see it highlighted here in yellow, is the actual definition of physical fitness. It has changed a bit over the years, and the last few versions of the guidelines has defined physical fitness as the ability to carry out daily tasks with vigor and alertness, without undue fatigue, and with ample energy to enjoy leisure time pursuits and meet unforeseen emergencies. This has transitioned to physical fitness being a set of attributes or characteristics individuals have or achieve that relate to their ability to perform physical activity and the activities of daily living. And then the other thing that I will go over with you are the blood pressure guidelines. In the 10th edition of the guidelines, you see it in the purple, table 3.2. We presented the guidelines by the Joint National Committee on the Prevention, Detection, Evaluation, and Treatment of High Blood Pressure. A couple years after the guidelines was published, the American Heart Association came out with some new guidelines, and we in fact immediately updated and changed to those guidelines. When the 11th edition of the guidelines came out, the editors decided to both continue to present the JNC, the Joint National Committee guidelines, and also the newer guidelines from the American Heart Association that you see again highlighted in yellow. For your exam, and what we will be using at the American College of Sports Medicine is the American Heart Association guidelines. ACC is the American College of Cardiology. So we're not asking you to know both of those tables that are in the teal color, but in fact to concentrate on the American Heart Association guidelines, and that's what you should know.
I'll discuss the next three changes between the GTAP 10 and GTAP 11. The change that is up here in front of you talks about the sit and reach, the Canadian trunk forward flexion. That is for a long time been used as a way to measure hamstring as well as low back flexibility. Currently in GTAP 11, that sit and reach evaluation has been removed, and simple goniometry will now be used to evaluate flexibility about various joints. The reason for that removal is because the sit and reach, while a standard measure for flexibility, does not take into account, and is not necessarily associated with low back pain, and does not take into account a person's age. So the goniometry standards are found, and how to do those are found in box 312. And as you can see here in the GTAP 11, the table 3.15 has the various joints, as well as the average value, and then how the value changes by gender as well as age category. One thing to remember is, although it seems like a very busy slide, again, there are certain joints to look at and really concentrate on the average values. And again, do they go up or down over time? So look for trends, look for generalities. The next modification between GTAP 10 and GTAP 11, again, another kind of long-standing formula to determine maximal heart rate has been 220 minus age. Many of us, however, know, utilizing that in both practice as well as in teaching our students, that that formula is subject to a lot of variation. It both underestimates as well as overestimates an individual's maximum heart rate. And so really doesn't have universal application. GTAP 11 now uses the Gellish formula, 207 minus 0.7 times age. That regression equation, that mathematical equation, is based upon a wider selection, a wider population of individuals, of both in terms of age as well as varying fitness levels. And then finally, the last modification, or the last difference that I'm going to talk about between GTAP 11 and GTAP 10, is found in the fit table for older adults. In here, although there are many similarities, in the GTAP 11, there has been an additional resistance training suggestion that has been added, and that is for power training for the older adult. Power training in terms of light to moderate, 30 to 60% of a repetition maximum, 6 to 10 repetitions at a high velocity. So think of lifting a bag of groceries. You can't do it in 5 minutes. You got to lift that bag of grocery off the counter and get that movement done very quickly. So the addition to the resistance guidelines, please add some power training of both light to moderate as well as high velocity.
So with that, we want to thank both Dr. Reeby and Dr. Bayless for sharing their thoughts and for being part of the team that collected these changes and put them together for you in a document which is accessible on the ACSM website. What we want to point out is that the updates to the professional standards and guidelines have not necessarily significantly changed an exercise professional's knowledge and skill or ability to practice. But it is important to know that as the science advances, so does our understanding, and so do our recommendations. And so going forward, we do recommend that you become familiar with the 11th version of the guidelines. And for those of you studying for an ACSM certification exam, congratulations on taking a wonderful step in your career. We're here to support you, and please go to acsm.org to consult any resources that you need, and please reach out if you don't find what you need, and we appreciate you.